You talk about feeding practices in general. One and the important aspect is breastfeeding, duration of breastfeeding. There are clear recommendations by WHO. When we look around in European countries, where the culture is of course different, there are very different reports on duration of breastfeeding. In UK, the duration is rather short. What is the reason? What do you think?
Well, firstly, I think we may have better figures than from some of the other areas, so the data could be perhaps more reliable. I think our breastfeeding rates, like any breastfeeding, they are actually increasing. So I think mothers are taking note of the advice to at least start breastfeeding, and we emphasise the importance of each extra day. So breastfeeding per se is increasing. What's not increasing is the proportion exclusively breastfeeding for 6 months as they're advised, although actually there has been a shift in when solid foods are being introduced. So if you look at the figures over the last 10 or 15 years, there's been quite a change from the majority of babies having solids before 4 months, and now it's much more of them at 5 months. So I think they may not reach 6 months, but most mothers are now introducing solids at 4 or 5 months.
Going to solids, is there any disadvantage if you introduce solids after 4 months rather than after 6 months? In terms of allergy prevention, in terms of celiac disease?
I think the recent evidence on celiac disease from 2 randomised trials that looked at timing of introduction of gluten, neither of them suggested that introducing gluten at either 4 or 6 months or at 6 or 12 months had any impact on the eventual occurrence of celiac disease. It was basically determined by your underlying genotype, whether you had one of the at-risk alleles. So in that sense, probably it may not matter when you introduce gluten. In terms of allergy, at the moment I don't think we have sufficient data to say that introducing allergenic foods beyond 4 months is either good or bad, but we have a number of randomised trials that are in progress looking at introduction of egg, peanut and a variety of allergenic foods from 3 to 4 months versus delaying them. And I think by next year we should have some more data on that, which will allow us to give better advice. But in the meantime, I think when solids can be introduced probably depends on where the baby is living, because as we've repeatedly said, if a baby is in a low-income country with no clean water or adequate complementary foods, then more prolonged exclusive breastfeeding is clearly the right thing because it protects against infection. It may be life-saving in that situation. But if we're talking about Europe or the UK, where the risk of the baby coming to harm from infection is less, but potentially there could be some advantage to having the solids from 4 months for allergy, for example, then maybe we need to be less dogmatic. And particularly, I say that particularly because obviously advising mums to exclusively breastfeed for 6 months doesn't seem to be what they feel is right for their baby. And I think that to override what they feel is right for their baby, we need to have some good evidence to tell them that it's harmful. So I think we should definitely encourage exclusive breastfeeding to 4 months, and beyond that at the moment for babies in sort of Western Europe, I don't really feel we have the evidence to say either way.
One last question. Is there evidence if you introduce solids before 4 months of age for an increased risk of later childhood obesity?
Well, again, the data, like for most of these outcomes, it's not exactly black and white. There is a suggestion from some observational studies that babies that have solids introduced before 4 months have a higher risk of, well, a higher percentage fat later in childhood. However, that's an observational study, and of course there are lots of potential confounders that could explain that relationship. So I think we're being sort of cautious, but the data that we have, although it's not perfect, would suggest that we shouldn't probably introduce them before 4 months. And in any case, I mean, nutritionally, there isn't really a requirement for the baby to have solids at that point.
Okay.
So I think 4 months is a sort of pragmatic figure at the moment.
Thank you.